Thank you so much for watching On Call for All Kids. Today we're talking about epilepsy and seizures. We'll be going over the signs and symptoms, when kids are usually diagnosed, and the treatment options that are available. I am joined by Dr. Jennifer Avallone. She is a pediatric epileptologist at JohnsHopkinsAllChildren'sHospital Hospital. And Dr. Avallone, it is so great to see you.
Thanks, Ashley. It's great to see you too.
And November is Epilepsy Awareness Month. So what better time than to talk about this now?
Exactly.
Let's start with the basics. What is a seizure?
A seizure is a disturbance in the electrical activity of the brain. An epileptic seizure occurs when a restricted group of brain cells or neurons abnormally communicate with each other. Ultimately, groups of neurons or brain cells are activated in a cascade, which creates a domino effect that produces the clinical symptoms of seizures.
Let's go over those symptoms. What should parents look out for in their kids?
Well, there are many different types of seizures. Some seizures start with an aura or a warning. A child can have symptoms of nausea or vomiting. Then a seizure can evolve into an ictal phase where there's that electrical disturbance of the brain cells, and patients can have loss of consciousness, loss of awareness, staring, stiffening. Their skin can change color. They can shake. Other types of seizures include jerking of the upper extremities very quickly or changes in vision. At times when the seizure ends, kids can be quite confused or have a headache or just sleep.
Well, I'd imagine for parents, this is very scary to actually see their child going through any of these things. What do they need to do if they're seeing that their kid does have some of these symptoms?
If your child is having a seizure, I often counsel parents just to try and stay calm and keep the child safe. You should place the child onto a flat surface on their side and do not put anything in their mouth. If the seizure lasts longer than 5 minutes or a child's having repeated seizures, trouble breathing, or change in color, 911 should be called immediately.
What causes these seizures to happen?
There are many different types of seizures. Certain etiologies include having head injuries, a genetic condition that predisposes to seizures, an infection of the central nervous system, changes in electrolytes, or an abnormality on an MRI, such as a tumor or another developmental structural lesion can cause a seizure. In patients with epilepsy, missing your seizure medication, having an infection such as an upper respiratory infection, being sleep deprived can also lower a patient's seizure threshold and cause a breakthrough seizure.
When are people most likely to develop epilepsy?
Children and elderly are the fastest growing segments of the population with new cases of epilepsy. New cases of epilepsy are often seen during the first year of life. Then the rate of epilepsy gradually goes down until about age 10 and becomes stable at that point. In the elderly around age 55, the new cases of epilepsy start to increase again.
Now, what are the treatment options available for epilepsy?
Depending on the type of epilepsy, anti-seizure medications are selected when the diagnosis is made. Other testing, such as electroencephalogram or EEG, brain MRIs, and genetic testing can help understand the etiology of the epilepsy. Once a patient has tried 2 seizure medications and continues to have seizures, that's called refractory epilepsy. All of those patients should be referred to epilepsy centers where other options can be explored for treatment. Here at Johns Hopkins All Children's, we have an epilepsy surgery program where we do pre-surgical evaluations. We also have state-of-the-art technology with stereotactic EEG with a robotic arm placing electrodes to gather information about seizures. We also have laser interstitial thermal therapy, which can be used for seizures. If those are not options for surgery, we also have a ketogenic diet program, which is another treatment option for epilepsy.
Well, Dr. Avallone, thank you so much for joining us and telling us all about seizures and epilepsy during the month of November. We really appreciate you being here.
Thanks so much for having me and raising awareness for epilepsy in November.
And thank you all for watching. If you want more information about pediatric healthcare, you can visit our website. It's hopkinsallchildren's.org/newsroom. You'll find many different patient stories and other programs and services that we offer at our hospital as well. We'll see you next week.